You always know when the next section is very important because somebody introduces the somebody who then introduces that next section. Are you ready? I am going to be handing over the moderating baton to my colleagues for the rest of today and tomorrow. I will be following online. I will be using the hashtag ICD. That one. Thank you. This is not a good time to be dyslexic. 2015, so I can follow the conversation even if I'm not physically here in this space with you. So right now, I will hand over to Betsee Parker. She is the Special Advisor at the Earth Institute, Columbia University, and the Sustainable Development Solutions Network. Betsee, please join us.
SDG goal number 3, ensure health for all people. In October last year, I attended a meeting at Columbia University in which were Skyped the exhausted faces of Ranu, Dhillon, and Ann Liu, who were in Conakry, Guinea, working tirelessly to get ahead of the curve in the Ebola crisis there. I was gripped by their testimonials and felt I wanted very much to contribute as a long-term sponsor and team member of the Millennium Villages Project. So I went to Jeff and Sonia Sachs to see what I might be able to do to contribute to the team's Ebola effort in Guinea. We decided I was to go to Guinea in March and meet with President Alpha Conde as a kind of goodwill ambassador and offer a gift of support for our team working so terribly hard there. When our West African team leader Amadou Niang and I arrived to meet with our small team of physicians and specialists, I was especially moved by the presentation they gave us and how each and every one of them was giving everything they had to help reconstruct a model for how community healthcare workers could be utilized to help turn the tide of Ebola. It seemed to me that our team members were the greatest hope that Guinea had. We met for several hours, and they spoke passionately of their devotion and dedication to this cause, pouring out every ounce of effort they had for the benefit of some of the most forgotten people on earth, those in West Africa who had contracted Ebola. It is so rare in life when we have the opportunity to gaze upon the face of greatness. But I truly thought our hard-laboring, loving, tender-hearted team had gone way beyond the call of duty in their tremendous quiet, behind the scenes working to overcome one of the worst scourges to hit humanity in recent times. Today we celebrate the 70th anniversary of the United Nations. And Secretary General Dag Hammarskjöld there once said, "You wake from dreams of doom, and for a moment, you know, beyond all the noise and the gestures, the only real thing is love's calm, unwavering flame in the half-light of an early dawn." Our Ebola team members were love's calm, unwavering flame. And they are Dag Hammarskjöld's light of an early dawn. And I was gazing upon the face of greatness. And it is now with the greatest humility and reverence that I proudly introduce our Ebola panel moderator, Dr. Ranu Dhillon.
Irwin and Beth, why don't you come up to the stage also? So it's a real honor to be here with you today, and we'll be moving very quickly to our discussants to talk about the future of global health through the lens of the SDGs and the Ebola epidemic and what we can learn from what's happened over the last year. A couple months ago, I was in Forakaria, which is one of the districts in southern Guinea that's really been the epicenter of the epidemic for the last 8-9 months now. And I was speaking with a woman in a village where there had been many cases, and many of those cases were happening also because people were hiding sick family members. And what she told me was that 2 years ago, when her neighbor's son was sick with diarrhea, they could find no help. They were going everywhere trying to find health care for something as simple as diarrhea. They could find no help. And she was wondering why all of a sudden were all these people coming in SUVs and so eager to help her and her family and protect their health. And that says something about the challenges of managing an Ebola epidemic and some of the reasons why the epidemic is still ongoing. It also says something about the challenges of really creating meaningful health care for the 2 billion people in the world who live below $2 a day. And we're going to talk a bit about both of that today and how those two linked challenges are really one and the same and need to be brought together in terms of how we move forward into this new era of the SDGs. Before I turn over to our panelists, I'll just say that since the era of the MDGs, we've made some huge strides in global health. We have unprecedented increases in funding. Child mortality has been cut in half. We've been able to make big gains on curbing the AIDS pandemic. But I think what the Ebola epidemic really shows us is that we have a long way to go. And we're far off from where I think we even thought we were, and where we actually should and could be if we really put our efforts in the right places. The epidemic had gone on for 3 months before we even knew what was going on. And then even when we knew what was happening, it took us even more months to create an emergency response system because there were no existing health systems that could actually be mobilized into controlling the epidemic. So I'm talking a lot about health systems because I think when we look at SDG number 3, a lot of it is premised on how do we achieve universal health coverage, but going past that, how do we create health systems that translate coverage into universal health delivery? And to dive into some of these questions, we have a great panel here today. Joining us shortly by phone is Emmanuel Dolo, who is the head of the Secretariat for the Presidential Advisory Council on Ebola for the Office of the President in Liberia. We also have with us Professor Irwin Redlener. Professor Redlener is a pioneer in advancing the health of underserved children, but he's here wearing his other hat, which is as a global expert on disaster preparedness. He's the director of the National Center for Disaster Preparedness here at the Earth Institute and has actually done some really pioneering work across the country and at the global level in that sphere. We also have with us Betsee. She's with the Earth Institute, a health systems program manager, who has been leading a lot of the efforts around creating community-based primary health systems across the Millennium Villages and has been instrumental in creating similar systems and programs that she'll talk about in managing Ebola and now moving forward, creating stronger health systems in Guinea. So I want to start first by inviting Dr. Dolo to give us some of his remarks. Do we have him available by phone?
Good morning. I'm sorry I couldn't connect by Skype, but what I will do is that I'm going to have a twofold presentation, but I'll do the first one real quickly because I've got 4 minutes as I'm told. So I'm going to talk about the lessons that we learned in Liberia, and perhaps if I have some time, I'll talk about survivors and some of the challenges that they're going through because we're doing some ongoing research. The first portion of my presentation is a research that we did alongside, my office did with the United Nations immediately following the Ebola outbreak or during the Ebola outbreak and coming to the end portion of it. Some of the essential lessons that we learned was that the international community failed to recognize the epidemic as a really major humanitarian crisis, but rather as a health sector problem. So there was that silo effect, saying it was a health problem and we didn't look at it as a humanitarian crisis. The response in Liberia, at least for Liberia, even though I've worked in the region, provided some very limited or no understanding of why the people in Liberia, the ordinary citizens, resisted behavior changes that they needed to do to be able to deal with the disease. We didn't have a keen understanding because most of our responders had some comparative understanding from elsewhere, but didn't have nuanced understanding of the Liberian society. The other was that we did not have sufficient data initially. It was not until we started doing social mobilization before we began to understand precisely what was going on within our different communities. The government of Liberia, for which I worked, had to be significantly transparent about how the disease was spreading. But we too were limited by some logistical resources that we didn't have. We had some constraints on logistical resources, and we couldn't travel all around the country to find out sufficiently where the disease had broken up. But this is the important one. Our local communities actually self-organized, and they failed to accept indifference as their response. So what they did was that they developed accountability measures among themselves, as well as holding government officials and the government responsible for what was happening, and that we needed to respond to their needs. If you know the Liberian culture very well, you know that this was not a society where people were empowered to act or to bring government to account. Another important factor was that we had a presidential leadership. Our president pushed us to the limit. For those of us who worked in her circle and worked for her, she pushed us really hard to be able to reach out and do this work. We also had budget support from our development partners, which helped us to pay the salaries of health workers, to pay hazard pay to health workers, which allowed them to work overtime during these very difficult moments. And then there was significant, very tight, consistent coordination between government and our donor partners, as well as our development partners. We worked together very closely, and because of the close working relationship, we were able to talk to one another very hard. And we had very difficult conversations that you would normally not have with one of your partners. The other part was that there were greater availability of beds in the last minutes of the response. And because we had available beds, there was increased attention to the infection, and we had safe barriers. In Liberia, we also had, literally to make a decision about burning the body. And I'm using burning the bodies literally because I'm saying to you, it was anathema to Liberian culture to start to, take bodies and put them over a burner and say we're going to burn them. This was significant consternation on the part of the public, and the government had to make that hard decision. We also had to focus on cross-border efforts between Guinea and Sierra Leone. We visited these parts and worked together significantly. I'll stop there for a moment, and then going forward, I can talk about survivors and the challenges that they face, and I can talk about other issues that would come up. But let me stop there for now.
Excellent. Thank you, Dr. Dolo. We'll come back to you to follow up on some of those additional points in the Q&A. Next, I want to ask Professor Redlener to come to the podium for his remarks.
Thanks, Ranu. And as a once, I guess, and always pediatric intensive care director, I'm not used to being called professor, but I guess that's a good thing. Thank you. Glad to be here. So I am actually filling in for Jeff Schlegelmilch, who works at the National Center for Disaster Preparedness, who I think is filling in for somebody else. But I was really glad to have the opportunity to come and talk to you, especially in this panel on the future of global health. And just to mention this before I get into a couple of particular and specific remarks, in some ways, global health is the main SDG in a way, isn't it? I mean, if people are not ultimately healthy, what's the point of the rest of it? Especially if we are defining health in a real public health way, which means the absence of poverty as well as being free from disease and being capable of reaching one's full potential. If that's how we're defining health, then I think that's ultimately what's going to matter. And in some ways, it's the test, the litmus test of the success of any kind of long-term goals for the planet. Ultimately will be measured in the health and the success and the possibilities for the people who inhabit the planet. So I want to make 3 points today. One is, and the first one has to do with the relationship of, before I get to Ebola, but the relationship of disasters generally to sustainability. And my point, the generic point here that I want to emphasize is that disasters, almost by definition, especially large, complex disasters, undermine sustainability. Period. If you don't have a sustainable society that is capable of properly preventing, preparing for, responding to, mitigating, and recovering from disaster, you have an inherent problem in how you're defining, in my view, which is coming from a particular perspective, view of what we mean by sustainability. We've been using a term in my center called mega disasters, which, just to tell you what we mean by that, we're talking about the large, complex disasters that cannot be managed within the region where the disaster occurs. So once you have a situation, whether it's in the United States or it's in West Africa, where you require assistance from outside of that region, you're into mega disaster land, which is defined by things like you can't rescue people in the immediate sense or treat them if it's a biological situation, or you can't get them out of the rubble if it's in Haiti. That is the first example of where the regional society and governance is unable to mount a response. Or if you can rescue people and you can't provide them with the care that they need immediately, that's a second level. If you have major infrastructure destruction that you can't prevent or deal with, another part of that definition. So what we're going to be talking about when I get to the Ebola part of this is the fact that we were dealing with a true mega disaster by all the criteria that I just mentioned. I also should say that my center deals with a whole range of disasters, including very large natural disasters, earthquakes and big storms and so forth. And we also deal with industrial types of disasters that we might see from a meltdown of a nuclear power plant, technological disasters like cyber threats, biological disasters like Ebola, and of course terrorism, which itself is a disaster in the sense that it destabilizes a society in ways that in some cases, if you're looking at Boko Haram or Al-Qaeda or ISIS, in ways that can have a very deleterious effect on the stability and therefore sustainability of society. And I'm going to get to, as I say, I keep telling this, I'm going to get to Ebola, and I promise I will. But I just want to mention one other thing that's very current, which is, in our point of view, a really serious disaster, which has to do with the global humanitarian disaster that is represented by the millions and millions of refugees that are wandering around this planet, as many as probably 40 million, millions themselves coming out of the Middle East. We just did an op-ed in the Daily Beast about the fact that there are at least 10 million children worldwide who are caught up in the immediate and long-term threats faced by this displacement under tremendously traumatic experiences. So we're talking about big-time disasters, and Ebola fits into that. The second point, though, that I want to make is this notion of lessons learned, which I don't know anymore whether that's a statement or a question or an aspiration. I don't even know what we mean by lessons learned. I can't begin to count how many lessons learned conferences I've been to over many, many years now of dealing with disasters and the aftermath of disasters. Lessons learned get discussed in things called hot washes and after-action reports and written up in white papers and all sorts of venues. We see this concept appear. And here's what I think we're really talking about. So the disaster, for an individual that's in it or watching it or working in it, is an experience, that's for sure. It's definitely an experience. And for some people, it's beyond the personal experience. It's also observations are being made. People were observed sitting on the rooftops in New Orleans when the city was flooded, when the levees failed. They were observed to be there. There are lessons perhaps noted by the experience of disaster, like that is a good lesson. I'm noting that. It's not just an experience, it's not just an insight, it's a lesson that I'm taking out of that. And going from the lessons learned to probably what I think is the most important in the fifth stage of this process, has the lesson been applied? And here's where we see massive failure globally, which has to do, and I mean globally in terms of not just resource-poor countries, but every country in the world, including the US, where we seem to be virtually incapable of taking the lessons that we've defined as lessons learned and then applying them. So new policies, procedures, protocols, preventive measures, and so forth are actually brought to scale and brought into use. And speaking of the situation with scale, this is another major problem that we had in West Africa, that we are having in dealing with the refugee crisis, that we've had dealing with Katrina, with Sandy, with Haiti, with the tsunami in 2004, and so forth. That we have a denominator problem. That when we say, what are we doing about Ebola? Or what are we doing about, Katrina? And we list the things that we are doing, those things, let's say, are in the numerator. The denominator is in what's actually needed. There's a gap between what is needed and what we're able to do, or what we do in the event of large-scale disasters. And that's a ubiquitous problem, and apparently it's a time-honored tradition, which is that we simply somehow fail to understand, comprehend, and absorb and put into place the actions needed to get us to scale for a whole bunch of reasons. Okay, so finally, what about Ebola? This was obviously an extraordinarily serious situation. It reached the level of mega disaster. It is a complex situation that required a lot of international intervention and coordination. At least 30,000 people were affected. I guess the fatality toll is around 11,000 this moment. Ranu, yeah. And it was really, really a horrifying, dangerous experience that the world watched unfold. The problems that we saw in dealing with the disaster in West Africa, which we have termed the Ebola crisis, were multifold. And they were not all that different on some levels from what we saw after Haiti. Insufficient resources, very bad coordination, a lot of confusion about sovereignty and who's in charge. It took several days for the Haitian government, already half destroyed by the earthquake itself, to give permission for at least U.S. planes to land with supplies and personnel to deal with that. It involved the State Department at the highest levels to just break through that bureaucratic block. Very unfortunate. And we've dealt with similar problems dealing with the tsunami, dealing with other international venues of disasters, including in the highly economically developed countries. And I would point to Katrina, the BP oil spill, complete, utter confusion, disorganization in the United States of America just a few years ago. Who was in charge of the BP oil spill response and management? Was it BP? Was it the US government? Was it the state of Louisiana? Was it none of the above? And the way the behaviors were observed, it's more in the range of none of the above, just massive confusion. The response to the Fukushima disaster after the tsunami in Japan, the same thing. Was it TEPCO, who owned the nuclear power plants? Was the Japanese government? Were there other international agencies responsible for the overall coordination? Very complicated questions anywhere, and particularly so in countries like those in West Africa. The problems there were just enormous, having to do starting off with late recognition and late intervention. It was known in March that we were going to have a big problem with Ebola and that we were worried about what was going to evolve, and it wasn't until August and September when we started to see mobilization of all sorts of agencies, including international agencies and particularly the World Health Organization, which is getting quite a lot of, in my view, deserved input, criticism about how it behaved in that crisis, and that's something we really do have to understand. The systems in general in the three most affected countries were essentially, if I could medically diagnose them, dysfunctional. They were dysfunctional. The World Health Organization has a ways to go before it can rid itself of that particular diagnosis, and we're all sort of watching with hopeful anticipation that that will get addressed. So what do we need to do? And then I'm going to stop, and then we'll discuss any of this or other things in the Q&A. I think the world needs to reset how we understand various responsibilities when we have complex international disasters. The relationship between international agencies, United Nations in particular, and local or national governments, rather, is confusing. There are serious issues of jurisdiction and authority and control, and those issues are not easily answered. We believe in the sovereignty of national governments. They need to have that sovereignty. But when does the insistence on sovereignty interfere with the coordination of a response to a major disaster that threatens not only that country, but neighboring countries and maybe the rest of the planet? I don't have an answer to this. I'm just saying we need another discussion at a much higher level to try to figure this out. We need better and faster science to try to respond to the scientific challenges of early rapid vaccine development and other things that I think may be germane to dealing with some of the biological threats. And we need a much, much more focused attention on the issues of prevention of large-scale disasters, which starts, of course, with understanding the impact of climate change, including on this current refugee crisis, which is a bigger topic that I don't want to get into here, but obviously for many reasons, dealing with and managing, controlling climate change is number one. Number two is we need civil stability in countries where disasters can be most destabilizing. So especially countries that are in the process of becoming sustainable societies, that are developing, they're at risk, they are vulnerable. They need to be protected by trying to accelerate the process of stability within countries that we're thinking about in terms of them being resilient over the long haul. And we need infrastructure resiliency. We can't have industrial entities like power plants that are not actually safe. We can't have thousands of levees in the United States and around the world that are just as unstable as the levees were theoretically protecting New Orleans in 2005 before Katrina struck. There are lots of things that we need to do from a preventive point of view, but I think I just want to part with this reaffirmation of my first statement, is that without the ability to prevent respond, mitigate, and recover from disasters in an optimal way in many parts of the world, we will not achieve the sustainability goals that we all desire. Thanks.
And Beth, I invite you to the podium to speak, or if you want to speak from here, whatever's you first.
Thank you, Ranu. So one of the key targets of the health SDG is capacitating countries to mitigate global health risks. And I want to share with you a specific programmatic example of how smart technology solutions can be leveraged to do this, can be leveraged to address epidemic situations and also strengthen health systems. I had the pleasure of working with the Guinea team that was mentioned earlier to deploy a real-time information system in Guinea to address the challenge of the lack of sufficient data that is necessary for a response to be able to act quickly and appropriately. As you all know, Guinea was where the first Ebola case was found, and along with Sierra Leone, there continue to be cases, very unfortunately, today. And contact tracing is a very important part of the containment of an epidemic. It involves following the contacts with confirmed Ebola cases on the ground throughout the duration of the disease's incubation period, and allows for quick action in the case of the development of symptoms or an instance of resistance in the community that can lead to the spread of the disease. Now, at the height of the epidemic in Guinea, there were thousands of contacts that needed to be followed at any one time. And this requires a really robust reporting system that can enable management teams to respond quickly to these events in the community that are often remote and detached from the formal healthcare system. And the system that was used initially at the outbreak of the disease was paper-based, which very understandably led to long delays in when data was reported and when it could actually be utilized by the response. And so what our team was charged to do in partnership with the government of Guinea and with UNFPA was to provide community-based contact tracers who were members of the community with smartphones that had a CommCare software on it that not only provided support for their interviews at the household level, but also reported directly into a real-time Tableau dashboard that allowed response teams to have access to this community-level data in real time in order to inform their decision-making processes around the epidemic. This program was rolled out in 5 out of the 8 affected prefectures, and to date has facilitated the monitoring of over 17,000 contacts in Guinea. It was deployed very rapidly in a low-resource environment with lacking the technical infrastructure of a developed country. And so while it highlights that these quick deployments of technical solutions are possible, it also highlights a lot of the challenges that need to be considered moving forward. And a key one that has been mentioned by both of our previous presenters is that coordination among partners and partnership building around these types of solutions. Both on the one hand, working with partners that are skeptical of these kinds of new disruptive technologies, but also to help coordinate what in Guinea was a proliferation of technological solutions that couldn't talk to each other and weren't coordinated in a strategic way. So a key part would be coordinating among these groups in order to really move towards an integrated data management system that can follow a patient from when they're initially identified as a contact through treatment and then hopefully out of the treatment system and back home in their communities. And once a system like this is in place, it not only can be used to address the current epidemic, but also to strengthen health systems more broadly. In Guinea right now, as they begin to reorient towards health systems recovery, they are looking at the deployment of community health workers who could use an adapted system to both deliver primary healthcare services that were neglected during the epidemic, such as treatment of malaria, and also provide routine health data in real time to managers to allow them to monitor health trends in their communities. This is really the way that technical innovations such as the CommCare system and smartphones and real-time analytics can address this current epidemic and strengthen health systems moving forward. Thank you.
So we have a couple minutes now before lunch, and we're a little bit tight on time. So we have a few questions. We're going to stick with one question, but I hope if your question is not addressed and you have other questions that you can come and find the panelists afterward. So I'm going to take one of these questions and have all the panelists respond to it, and that is, there's been a lot of discussions about lessons learned. There's been a lot of sort of post-mortem, what happened wrong, what needs to be done differently. We have a lot of people in the room who have influence of different kind and are working on these issues, and I think are trying to move forward the agenda in a way that we are better prepared the next time and better manage the next epidemic or the next disaster, or mitigate these from happening by strengthening health systems. What is one concrete pragmatic action that you would recommend from your vantage point, whether at the global level, at the programmatic level, or at the national level, like Dr. Dolo was speaking from? So I'm going to start with you, Dr. Redlener.
Thanks, Ranu. So, if you could just wave a magic wand here, I think we really do need a new understanding as operating principle between international organizations and national governments. There's something that just simply doesn't work in the current situation. I think we get really exactly the same kind of situation that we saw in West Africa and in Indonesia and in Haiti the next time, because there is a fundamental misunderstanding about who gets to control a very complex situation. And without that ability to coordinate and organize, I think it's just incredibly challenging.
Excellent. Beth, you can take the next.
Yes, I would agree that coordination among partners is a hugely important for moving forward. It was definitely one of the largest challenges that we faced in implementing a system that was requested by the government of Guinea. It was something that a sovereign government had asked us to come in and implement, and we really faced a lot of resistance on the ground from international organizations who saw who really saw the epidemic as their territory and were very resistant to having systems that they had invested in. Even something just as simple and rudimentary as a paper-based system moved out of the way for something that could facilitate a smarter use of data for Ebola response. So I would second that very strongly.
Excellent. And Dr. Dolo, do we still have you online? We may no longer have him. So I'll cheat and take his chance to answer and also give my own opinion. So I do think this thing about having a preset idea of how people are going to orchestrate and work together is crucial. I can say in Guinea, we saw the epidemic.
Can you hear me from here?
Oh, Dr. Dolo, sorry. I'll give you back your answer. So the question is, there's a number of lessons learned, recommendations, etc. Okay, go ahead.
I heard the question.
Go for it. It's all yours.
Yeah, I think my colleague was right, but here's the point. I think one of the major hurdles we faced, probably within the sub-region, since I spent some time in Guinea and in Sierra Leone, was the question of what our partners brought to the table. They brought to the table comparative knowledge. But what they did not have was a really nuanced understanding of the societies in which the problems were happening. And what they wanted to do was sometimes transfer technology, whether it was social technology or some of the modern technology, without relating them to the societal problems that we were having. And once you had a limited understanding of the society and its own experience, you definitely could, your technology, as good as it was, could not make an impact. So and if you go into the society with that sort of cultural arrogance that you have the answers, and you're not willing to collaborate with the professionals on ground to gain a keen understanding of what's happening there, you will face the same challenge because people will resist you.
Excellent, thank you. So I'm going to take the balance of time to give my opinion really quickly, just one response. So I think something that's we've all kind of touched on it, but and also alluded to generally, I think we're at a point where we really need to move past trying to come with interventions when there's crises. And I think really, we talk about this idea of really building community-based primary health systems. I think it's become a little bit almost cliche to talk about. But I think it's 2015, we still have children who die from diarrhea, and this is something that's imminently treatable and solvable. And I think we're at a point where there's no more science that we necessarily need to be able to handle that. There's no more delivery science and experience we need. Certainly we'll come up with better ideas. But I think it's really at a point where I think we need to consolidate that and really make this, take this Ebola epidemic as a wake-up call to really move forward on that. And to me, once you have a system that's in place, when there is an epidemic, you can pivot that system into being an epidemic control system. And that system would have trust, would have engagement with the community already. What we've kind of been doing now with Ebola is there were not health systems in place. We created a massive health system from scratch to manage the epidemic with a lot of different politics and other delays. And now what we're trying to do is pivot that emergency system into a general health system, which I think is the right direction to go in. But I think it's a time where we shouldn't wait for the next emergency to then say, this is what we need to do. So with that, I want to thank our panelists, and especially Dr. Dolo for calling in from Atlanta. Join me in giving them a round of applause.